Well, mental health experts at McMaster Children's Hospital in Hamilton are helping to develop a new program to help deal with the urgent need for suicide prevention. It's a 3-year study called I Am Safe, and the study's lead investigator, Dr. Khrista Boylan, joins us with more. This is so needed right now because the pandemic just exacerbated teenage self-harm and suicidal thoughts.
Yes. It absolutely has, and unfortunately probably a good 10 years prior to the pandemic, we'd seen an increase in these struggles in teenagers.
And even at that time, before the pandemic, there was so little help for mental health for children and teens.
Yes, that's very true in general, and in specific for this population of teenagers who struggle with suicidal thoughts. The intensity of service wasn't available. We had things that we were doing to try to help here and there, but we really needed something coordinated that we could rest assured was going to deal with the risk that they had. And that's what this study is testing out.
Okay, so you're still looking for patients to come, but it's a specific type of patient. So someone who comes in with maybe a suicide attempt or very serious, they will be kept overnight, and that goes into a whole different range of care. But these kids coming in, they get to be part of, or maybe part of, the I Am Safe program.
Yes, absolutely. And it might be helpful for me to tell you a bit about I Am Safe and of the idea behind it, because there's different levels of need that kids have when they have suicidal thoughts or if they've made a self-harm attempt or suicide attempt. This study is intended for young people who come in for help in the emergency room, and then we determine they can go home. We can manage their risk and support the family in the community, so no stay in hospital. And then we offer 6 weeks of pretty intensive child as well as family therapy for about 2 hours a week. And we're trying to test, is this coordinated approach better than what we were doing before?
Because so many times the families, they're left to cope, and they're so afraid of leaving that child alone, because what could happen?
Absolutely. That's exactly what the intervention focuses on, because we know, and in fact some research has already shown, that when you involve parents or caregivers in assessing the risk and supporting the teen, they do so much better. And so the I Am Safe is a manualized intervention that we hope can be disseminated across the country to all kinds of emergency settings, and it teaches the therapist exactly what to go through with the family and the youth to help communicate about risk and how to manage that risk, because you can't sit on your teenager all day long. I mean, that makes everybody very stressed.
And it teaches the teenager too that it's okay not to be okay.
Yes, that's right. Because I think in many ways that is the fear that brings a lot of families in, is that there's something really wrong with my kid, or that there's, a mental health problem isn't fixable. But that isn't true at all. These are normal teenagers going through difficult times in their life, and they really need someone to help them in a way that's not actually that weird.
And right? that's a good, I hope you explain it to them that way too. I'm sure you do.
Well, we don't want to increase stigma around this problem. It's unfortunately common.
Very common. And I'm sure that so many parents out there would be thinking, no, this is just happening, and this is our, they're keeping it a secret. Whereas you think if a child had diabetes or cancer, you would be telling everybody.
Exactly, that's it. And we never want to say to people, tell everybody what's going on in your family, but at the same time we want to reduce shame by helping people understand that these things happen, and sometimes they're very brief, and they can be, the stress in the child and family can be shortened by actually working on it right away and talking about it.
Okay, so if parents or teens are watching this right now, how can they become involved or get more information?
Right, that's a great question. So this is a research study. I definitely want to preface that. We want to know that this works before we say, give us a call and learn more about it. Right now, the only way to get involved is to be a patient at one of the hospitals in the research study and found to be eligible to participate.
All right, we're just about to run out of time, but we'll get all the links for this very, very important work going on at MAC and across the country at chch.com. Khrista, thanks so much for coming in.
My pleasure.